Hi everyone, Dr. Jeff here today. Today we're talking about carpal tunnel syndrome. Carpal tunnel syndrome is actually a condition where your fingers start to get nummy and they start to fall asleep. Generally it's more your thumb and these three fingers, because this finger is actually innervated by the ulnar nerve. These are by the median nerve. The median nerve actually starts in your neck and actually rolls down your arm, goes through this tunnel here called your carpal tunnel. And with overuse from too much mousing or trauma, overuse, this tunnel becomes swollen and compacted, and the median nerve running through there can actually get pinched off, and you get the tingling in the fingers and the thumb. Generally, you'll find with people with this is that when they're driving the car, it starts to go tingling and numb. Reading a book, a lot of people will find at night that they wake up, their hands numb, they have to shake it out to get rid of the tingling and the numbness. Most commonly found among women more than men. Not really sure why that is. But a big thing with this is there's no pain in the wrist at all. There's no pain that causes you to stop using your wrist, and that's a big distinguishing factor between what you've done to your wrist and what carpal tunnel syndrome is. Here at the Goldsworthy Wellness Center here, we actually use something called Carpal Tunnel Dis-traction to work on carpal tunnel syndrome. As I say, it's a fairly big machine. The idea of the machine is it actually pulls the wrist out. So we pull out in one direction this way, then we go out and we turn it this way, and we go out and we turn it this way. It's painless. It's not supposed to be any pain with this at all. The idea of it is we actually take that carpal ligament, we actually stretch it in three different directions, trying to create the carpal tunnel to be a lot bigger, and that takes the pressure off the nerve. Here we're about 90% successful in treating carpal tunnel syndrome, but part of that is that the other option you have is surgery, and what they do with surgery is they just look at your wrist and they slice your wrist open, they let it bleed, they let the pressure release, and they stitch you back up. But what happens, as I mentioned, the median nerve starts in your neck and goes all the way down your arm. If that nerve is trapped anywhere between your neck and your wrist, slicing your wrist open is not actually going to make it better. So here we actually examine you when you come in, and we're looking at entrapments in your shoulder and your neck and your elbow and your forearm into your wrist. And if we're finding anything in there at all, we can do some active release therapy or some adjustment to try and release the nerve coming down. It's kind of like taking a thread and a needle and actually pulling the thread through the needle and trying to make sure that that thread's being pulled all the way through and there's no resistance. That's why we're so successful here in treating carpal tunnel syndrome. It takes between 10 and 12 treatments. We're about 90% successful. If you know of anybody that has carpal tunnel syndrome and they're looking for relief, they can certainly give us a call or send us an email at jgoldsworthy@goldsworthywellness.com. That's our talk on carpal tunnel syndrome. If you like this video, share it with your friends. I'm Dr. Jeff, and I've got your back.